Hey everyone, while there is certainly an increase in awareness for health plan, I've observed that many people miss out on important features. Since health plan is something that we don't buy frequently, we need to ensure that our health plan should be highly comprehensive and cover all important features. So in this video, I want to discuss key features that you should be aware of before taking a health plan. Alright, let's get started. So first important feature is ensure no co-payment clause. A lot of people have the tendency to opt for cheaper health plan. But the problem is, in health insurance, cheaper is not always the best option. Because some insurance plans come at a very low cost, but they might have a co-payment clause where you need to split the bill. That is, you need to pay, let's say, 10-20% of the bill from your own pocket. For example, let's say you opted for a health insurance with 20% co-payment clause. Now let's say you end up with a medical expense of 2 lakh. In that case, you will have to pay 20% of 2 lakh, that is around 40,000 out of your own pocket. That's a lot of money. And what if you end up with 5 lakh expense? Then you will have to pay around 1 lakh rupee out of your own pocket. So in order to save some money on annual premium, you could end up with paying huge money out of your own pocket. So make sure that you opt for a health plan without any co-payment clause unless you don't have any option. Then second feature is always check for restriction on room rent. Some insurance policies have a cap on room rent. For example, a cap could be 1% of sum assured. And if you take a health insurance of let's say 5 lakh rupee, then 1% of 5 lakh would be 5,000 rupee. By the way, considering the rising cost of medical treatment, 5,000 per night for a room in a good private hospital is not a big deal. Now let's say you got admitted in a hospital and you find that a room at 7,500 rupee a night is better than your limit of 5,000 rupee a night. And let's say you have to stay for 2 days. So you do calculation and think that you have to pay an additional amount of just 5,000 rupee for the room, as remaining 10,000 you will get from the insurer. So you opt for the room that costs 7,500 a night. Mind you, it's over and above your maximum limit of 5,000 rupee a night. Now let's say you had some surgery and the medical bill was 1.5 lakh rupee. So you might think that you just need to pay an additional 5,000 for the room out of your own pocket. Rest everything will be taken care by health insurance policy. Well, guess what? You will have to pay 50,000 rupee out of your own pocket. Here is the math. Since you opted for a room worth 7,500 a night, whereas your limit was 5,000 a night, so you ended up paying 1/3 of the cost of the room out of your own pocket. But this 1/3 cost is not just applicable to the room. It would be applicable to the entire service, including the surgery cost. So this is a catch. You have to pay 1/3 of the total medical bill. And that's where you have to always ensure that there should not be any cap on the room rent. Now, a lot of people ask me, Sahil, please suggest the best health plan. And I always say that there is no best health plan. Every person has a specific requirement as per the health condition. And there are various health plans that caters to your specific need. Now, one big catch here is that the health plan documents are very comprehensive with a lot of terms and conditions. So it's difficult for a layman to understand the details. And sometimes we miss out on the key points. And that's where I always suggest setting up a free 30-minute call with Ditto team. It's a startup backed by Zerodha. They offer honest and 100% spam-free insurance advisory for free of cost. Their team can also help you select the right plan, and you can also discuss if your existing health plan is right for your family or not. In fact, you can also visit Ditto website and they have simplified the detail of various health plan in layman's language. For example, let's say you want to know the detail of HDFC Ergo health plan. So you just select the health insurer and its health plan, and Ditto will show you all the details in terms of what is good, what is okay, what is lagging. They also provide a detailed checklist of key points that you should keep in mind before buying a health plan. Moreover, they have a claim support section where you can get timely assistance from Ditto dedicated claim support managers. In case you want to explore Ditto platform, I provided the details in the description. Then third important feature you should know is check the disease-wise sublimit. Some health insurance policies have a disease-wise sublimit where they have a cap on the total coverage amount for specific disease. For example, let's say you opted for a health insurance coverage of 10 lakh rupee. Now, there could be a case where the health plan has a cap on pre-existing disease. For example, a cap of 2.5 lakh rupee on cardiovascular issue or a cap of 2 lakh rupee on knee replacement, and likewise. So make sure that your health plan does not have any disease-wise sublimit. Then fourth feature is check for pre and post hospitalization charge. While we ensure that the health plan covers all the expenses during the hospitalization, majority of people ignore the pre and post hospitalization charge, and that could also cost you a lot. For example, you might feel pain in your chest and you consult your doctor. Now, doctor might suggest some diagnostics like your MRI, CT scan, and they admit you to the hospital after those tests. So there could be a case where the health insurer only covers the expense during your stay in the hospital and does not cover the MRI or other diagnostic test. So make sure that your health insurance plan covers both pre and post hospitalization charges between 30 to 60 days before and after your treatment. Then fifth important feature is check for no claim bonus. So let's say you opted for a health insurance plan and did not claim for any health expense for next 3 years. Would you get any benefit for not claiming the health expense? Well, there are health policies that offer you a bonus in case of no claim. For example, one of the bonus could be that in case of no claim, they increase your health coverage by a specific percent. So let's say you opted for a health plan of 5 lakh and did not claim any expense, then next year your insurance cover could increase to 7 lakh rupee. And likewise, next year your coverage could increase little further. Of course, there would be an upper limit. But this is a pretty good way to get a high coverage as the cost of healthcare is increasing exponentially. Then sixth feature is check for other benefits like your free healthcare checkup and alternative treatment. Ideally, everyone should get a general health checkup at least once in a year, and some health plans provide the benefit of free health checkup, which is a nice to have feature. Then apart from regular medical treatment, there are alternative medical treatments like your Ayurveda, yoga, naturopathy, homeopathy, also known as Ayush treatment. And some diseases can be cured by these alternative treatment. Although not every health insurance plan would give you this benefit of Ayush treatment. So it's a good to have feature that you can consider in your health plan. Then seventh feature is ensure your health insurer provide cashless facility and cover major hospitals in your city. There was a time when we have to pay money upfront out of our pocket at the time of our treatment and then later claim the money from the health insurer. And hospital treatment requires a good amount of money, which is not easy to arrange immediately. However, now there's a cashless facility where you don't need to pay anything out of your own pocket. Everything will be taken care by the health insurer, provided you visit the hospital that accept the cashless facility of that particular health provider. So make sure that your health insurer covers the top hospital in your city and provide a cashless facility. Then eighth is check for claim settlement ratio. Claim settlement basically means that out of 100 claims, how many claims were settled by insurer? A claim settlement ratio of 98 means out of 100 claims, 98 claims were settled. Obviously, higher the claim settlement ratio, better it is. Now, sometimes health insurance policies are so rigid or they have so many terms and conditions that your claim settlement chances reduce significantly. So make sure that before taking a health plan, you go through the claim settlement ratio detail published by IRDAI. For instance, here's the data for FY 21-22 where you can see the health insurer and its claim settlement ratio. Higher this ratio, better it is. Now, one of the very important questions that people ask is, Sahil, I have a parent, wife and kids. Should I opt for individual health plan or should I take family floater? So my answer is simple. If you have a wife and kids, then always go for a family floater plan that covers your entire family. But you have elderly parents, it's always better to opt for a separate health plan for your parents. Simply because your health insurance premium is decided based on the age of eldest member in the family. And if you include your elderly parents, then your health insurance premium will shoot up a lot. Also, there are a lot of complications in elderly health insurance. For example, you have to opt for Copayment Clause after the age of 65, where a certain expense would be borne by you. So better take two health plans, one for yourself, your wife and kids, and one for your parents. Now, when you take the family floater plan, do check for restoration benefit. Now, this is again important. For example, let's say you have taken a family floater plan with a coverage of around 5 lakh rupee and you ended up with a medical expense of 4.5 lakh. Now, what if your wife also end up with a medical expense of, let's say, 2 lakh rupee? Since you have already consumed that 4.5 lakh out of total coverage of 5, you are only left with 50,000 rupee. In that case, how will you cover your wife's medical expense of 2 lakh rupee? So if you have restoration benefit, then your coverage of 5 lakh will be restored after you have claimed 4.5 lakh. It means you can again claim your wife's 2 lakh rupees of medical expense. Although some health plans have a restriction on restoration benefit for some disease. So restoration benefit is a good to have feature, especially when you are taking a family floater plan for your family. Now, another important feature that you can consider is super top-up plan. This is especially useful in case of elderly parent. Super top-up mainly means that, let's say you have taken a health insurance of 10 lakh. but some of the treatment can become really costly. For example, diseases like cancer, heart issue, it can cost you a lot. So you can take a super top up of, let's say, 10-15 lakh on top of your health plan of 10 lakh rupee. Now, if you opt for a health plan of 20 to 25 lakh, then it would cost you a bomb. But if you opt for a super top up of 10-15 lakh on top of your health plan of 10 lakh, then it would be very economical. So this super top up is very helpful for those who have serious health issue in the family. Now, I also get a common question that, Sahil, I have a health insurance from my employer. Should I continue with that or take a separate health plan? In that case, remember that the moment you quit your job, you lose your health insurance policy. And if anything happens before you get the health coverage from another employer, you'll always have to bear the cost from your own pocket. Plus, your new health policy will start from scratch with the waiting period for certain diseases and so on. So it's always advisable to not depend upon your employer health plan and better to opt for a separate health plan. So in this video, we discussed the important features that would help you take a comprehensive health plan. If I summarize, always ensure that there are no copayment clause, ensure that there are no restriction on room rent, make sure that your health plan does not have any disease-wise sublimit, make sure that your health insurance plan covers both pre and post hospitalization charges, then check for no claim bonus, check for other benefits like your free health checkup, alternative treatment, then ensure that your health insurer provides cashless facility and cover major hospital in your city, and always check for claim settlement ratio. And when you take the family floater, check for restoration benefit. In case you are still not sure about selecting the right health plan, just set up a free 30-minute spam-free call with Ditto team and they will help you. And before we close this video, just last thing I want to mention. While taking the health insurance, you will have to fill a form where you have to declare your details, including medical history. Please make sure that you fill this form properly and disclose all medical detail, because there have been cases where medical claims got rejected due to incomplete or incorrect information. So I hope this video will help you identify important features to select a comprehensive health plan. By the way, have you ever used a health insurance? Would love to know your story. I will see you next video. Till then, take care.